Welcome back. In this video, I will discuss constipation in adults. Constipation is a problem with passing stool. Constipation generally means passing fewer than 3 stools a week or having a difficult time passing stool. Symptoms of constipation include fewer than 3 stools a week, hard, dry, or lumpy stool, straining or pain when passing stool, a feeling that not all stool has passed, a feeling that the rectum is blocked, the need to use a finger to pass stool. Chronic constipation is having 2 or more of these symptoms for 3 months or longer. Now, when to see a doctor? Make an appointment with your healthcare professional if you have constipation with any of the following conditions: symptoms that last longer than 3 weeks, symptoms that make it difficult to do everyday activities, bleeding from your rectum or blood on the toilet tissue, blood in your stool or black stools, other unusual changes in the shape or color of the stool, stomach pain that doesn't stop, and weight loss without trying. Now, the causes of constipation. Patterns of bowel movements vary from one person to another. The typical range is 3 times a day to 3 times a week, so it is important to know what is typical for you. In general, constipation occurs when stool moves too slowly through the large intestine, which is also called colon. If the stool moves slowly, the body absorbs too much water from the stool, and the stool becomes hard, dry, and difficult to pass. So, first cause of constipation is lifestyle causes. Slow stool movement may happen when a person does not drink enough fluids, does not eat enough dietary fiber, and does not exercise regularly, and do not use the toilet when there is an urge to pass the stool. Second cause of constipation is medicines. Constipation may be a side effect of some medicines, particularly opioid pain relievers. Other medication that may cause constipation include some that treat the following condition, such as pain, high blood pressure, seizures, depression, disorders of the nervous system, and allergies. Now, third cause of constipation is problems with the pelvic floor muscles. The muscles that hold up organs at the bottom of the torso are called pelvic floor muscles. The ability both to relax these muscles and to bear down are necessary to pass stool from the rectum. So, problem with weakness or coordination of these muscles can cause chronic constipation. Fourth cause of constipation is blockages in the colon or rectum. Damage or changes to the tissue in colon or rectum can block the passage of stool. Also, tumors in the colon, rectum, or nearby tissue can cause a blockage. Now, a number of conditions can affect the work of muscles, nerves, or hormones which are involved in passing stool. Chronic constipation may be linked to any number of things, including irritable bowel syndrome, diabetes, multiple sclerosis, nerve dysfunction or damage, Parkinson's disease, pregnancy, and sometimes the cause of chronic constipation can't be found. Now, factors that may increase your risk of chronic constipation include being an older adult, being a woman, getting little or no physical activity, and having a mental health condition such as depression or an eating disorder. And complications of the chronic constipation include swollen tissues around the anus, which are called hemorrhoids, torn tissues of the anus called anal fissures, hard stool backed up into the colon, which is called fecal impaction, and exposed tissue of the rectum that have slipped out of the anal opening, which is called rectal prolapse. Now, the following tips can help you avoid developing constipation. Eat lot of high fibers food, including vegetable, fruits, beans, and whole grain foods. Eat fewer foods with low amount of fibers, such as processed foods, dairy, and meats. Drink plenty of fluids. Stay active and exercise regularly. Don't ignore the urge to pass the stool. And create a regular schedule for passing stool, especially after a meal. Now, the diagnosis. In addition to giving you a general physical examination, your healthcare professional will likely do the following during your appointment. Gently press on your abdomen to check for the pain, tenderness, or irregular lumps. Look at the tissue of the anus and the surrounding skin. Use a glove finger to check the condition of the rectum and the muscles of the anus. You will also be asked questions about your medical history, diet, exercise, habits, and stools. Now, for some people, the information from this appointment may be enough for a diagnosis and treatment plan. But for other people, one or more additional tests may be needed to help the healthcare team understand the nature or cause of constipation. This is first a laboratory test. Your healthcare professional may send samples of your blood to a lab to test for diseases or conditions that can cause constipation. Second is endoscopy. Your healthcare professional may order a procedure which is called endoscopy. In this, a small tube with a camera is guided into the colon, and this can reveal the condition of the colon or the presence of irregular tissues. Before this procedure, you may have a limited diet, use an enema, or drink solutions that clean out your colon. Now, third test is imaging studies. Depending on your symptoms, your healthcare professional may order X-ray imaging. An X-ray can show where the stool is present in the colon, and if the colon is blocked, imaging tests such as CT scan or MRI may be needed to diagnose condition that may be causing constipation. Now, the fourth test for constipation is test of stool movement. Your healthcare professional may order a test that tracks the movement of stool through the colon, and this is called colorectal transit study. Such studies include radiopaque marker study and scintigraphy. Radiopaque marker study is a X-ray procedure which show how far tiny pellets from a pill have moved through the colon over a period of time. And scintigraphy is a study which involves eating a meal with tiny radioactive substances, and these are tracked with special technology as they move through the colon. Now, fifth test for constipation is test of rectum and anus. These include anorectal manometry, and in this a narrow flexible tube is inserted into the anus and rectum, and after a small balloon like device is inflated, it is pulled back out of the anus. The procedure measures the coordination of the muscles used to pass stool. Second test is balloon expulsion test. This test measures the amount of time it takes to push out a small water fluid balloon in the rectum. This provides information on how well muscles work or are controlled. Third test is deficography. This test is designed to mimic passing stool. A thick substance that can be tracked with imaging technology is placed in the rectum, and X-ray or MRI images can reveal information on how well the rectum and anus work when the substance is passed like stool. Now, the treatment for constipation usually begins with the diet and lifestyle changes meant to increase the speed at which stool moves through the colon. Also, your doctor may change the medicines you take if they may be causing or worsening the constipation. If those changes don't help, then other treatments may be necessary. So, number one is diet and lifestyle changes. Your doctor may recommend the following changes to relieve your constipation. Eat a high fiber diet. Fiber adds bulk to the stool and help the stool hold fluids. These factors give stool the right shape and weight to move through the colon. Fiber-rich foods include fruits, vegetables, beans, and whole grain bread, cereal, and rice. Increase dietary fiber slowly to prevent bloating and gas. The dietary guidelines for the Americans recommend 25 to 34 grams of fiber a day, depending on recommended daily calories. Second is drink plenty of water. Drink water and beverages without caffeine. This keeps stool soft and prevents bloating and gas that can happen with increased dietary fiber. Then next is exercise most days of the week. Regular physical activity help improves the movement of the stool through the colon. So try to exercise most days of the week. If you do not already exercise, talk with your healthcare professional about safe ways to start. Then use good bowel habits. Don't avoid the urge to pass stool. Keep a schedule for passing stool. For example, try to pass stool 15 to 45 minutes after a meal because digestion helps move stool through the colon. Next, eat prunes, which are also called dried plums. They have long been used to treat or prevent constipations. Prunes are a good source of fiber, but they also have a naturally present agents that draw fluids into the colon. Second treatment option for constipation is laxatives. Laxatives are medicine that help move stool through the colon. Each laxative works somewhat differently, and the following are available without prescriptions. These are fiber supplements, osmotics, stimulants, lubricants, and stool softeners. Now, next treatment option is enemas and suppositories. An enema is a fluid gently pumped into the rectum to help pass stool. An enema may be used when other treatments don't work. Your healthcare professional may use one of these if the rectum is blocked with stool. Some are also available without prescription. The fluid may be tap water with mild soap, or mineral oil. Now, a suppository is a small tube shaped object which is placed in the rectum to deliver a medicine. The suppository melts at body temperature and releases the medicine. Suppositories for constipation may have osmotic laxative, stimulant laxative, or lubricant laxative. Next is prescription medicines. Your healthcare professional may prescribe these medicines if other treatments don't work. And if constipation is caused by opioid pain medicine, you may take a prescription medicine that blocks the effect of opiates on the stool movement through the colon. Now, next is pelvic muscle training. Biofeedback training involves working with a therapist who uses devices to help you learn to relax muscles and coordinate the use of muscles in your pelvis, rectum, and anus. These exercises may correct the problems with chronic constipation. Now, sensors in the rectum and on the skin provide feedback as sound or light on a device, as the therapist helps you go through various exercises. These cues help train you to control the muscles needed to pass the stool. And the last treatment option for constipation is surgery. Surgery may be necessary to correct the damage or irregularities in the tissues or nerves of the colon or rectum. Surgery is usually done only when other treatments for chronic constipation haven't worked. I hope you liked my video. Thank you and subscribe to the channel.